Okay, so we've all of you have suggested really important things. I'd like to just kind of recap and ask one question of each of you to state after all of this. What do you think is the most important step that we in dentistry, knowing how far behind we are, what should we do? What's the most important thing that all of us should do? If you could just pass a little, action steps to us.
I will start. I've thought about this a little bit. Again, I think there's just a gap between there's not that much known about how much is actually produced. And so let's avoid, the medical community just realize that AGPs don't generate much in terms of aerosols that they've been protecting against. So I would just encourage studies, where there's really straightforward ways to start to understand how much aerosols are actually being produced. So kind of understand, are you actually producing more? You may find out that there's not as much, and there's ways to do it, but to move beyond sort of the settling plates and thinking about bacteria, basically that would be adding maybe genomic sequencing and things like that to really understand what viruses are in the air. And this moves beyond COVID. This is would help health, for dental people for a lot further beyond, the flu and everything else that we've talked about. There is a good chance that all of these have had a huge airborne component that hasn't been acknowledged like it should. And so that last thing I'll say is just that's the key. Acknowledge it's airborne. Acknowledge that most of these are probably have a very big airborne component. It's not the only component, but it's probably the good likelihood it's the biggest component. One thing you have to also remember about aerosols, that once it's in the aerosols, the tinier they are, the deeper they go in your lungs. And so now they're starting to think that the disease can actually be much more severe than it would be if you got it off of the surface. And that's not something to take lightly. So acknowledge it's in the air, understand, sort of the sources, and then Shelley will probably want to comment on the best cleaning ways to clean it, because this is so fixable. But if you ignore it's in the air, we're just going to keep going down this route.
Thank you.
Yeah, I would recommend that you assess the state of your ventilation and what is your air look like. And I don't know, for hospitals, there's hospital standards for ventilation in buildings, and I don't know if that's the case for dentistry, but I would say if it's not, it needs to be done. And I would say starting with healthcare facility ventilation guidelines is a great way to start. But I think you need to invest in working with an industrial hygienist to come into your space and ask them, what does my ventilation system look like? How do I clean the air in my space? And then go from there in terms of supplementing and making sure your air changes and your ventilation rates per person are adequate to control infectious disease transmission, meeting the numbers that I have presented today, for example. Minimum of 6 air changes per hour and getting up to 10 liters a second per person in that space, at least by supplementing with UV filtration if your ventilation system is non-existent or is not providing you enough clean air.
Actually, can I just chime in really quick to tack onto that? Good ventilation is not going to help you, though, as much for up close exposure when you have these really close contact. So you have to make sure that those people are properly protected. And so they should be wearing an N95 and a shield, right? And so make sure that the people that are the closest, because the best ventilation in the world isn't going to stop that up close inhalation. So I would be remiss if I didn't mention the respiratory protection.
No, that's exactly right. Ventilation, air cleaning, UV is for the long range transmission, but up close, I also really like Don's presentation where he emphasized source control, because as an environmental engineer, you start with the source and you try to control that immediately at where it's being emitted, because once it gets out into the environment, it's super hard to clean up, right? So you reduce it at the source, masks, PPE, source control, exhaust, whatever you need for the generation part. And then if you've succeeded, then you really don't have to worry quite as much about your general room air cleaning.
Yeah. And the suction does, as he mentioned, the suction does work. It looks like the one, I think I've seen 2 studies, it really drives down even the aerosols. So that's yeah, I agree.
Yeah, I like Don's approach of the layers. All of you have said this in different ways, that we're just layering one thing after another, both in time and space and distance, and we're just trying to put it all together in a meaningful way.